Good morning, good afternoon, and good evening. I would like first to thank all the 728 participants from more than 40 countries that registered for this webinar organized by the Medical School of the Aristotle University of Thessaloniki in Greece and concerns mental health services amid the COVID-19 pandemic in Europe. What lessons can we learn and act on? My name is Kostas Fountoulakis and I'm Professor of Psychiatry, member of the World Psychiatric Association Board for South Europe, and WHO focal point for mental health for Greece. I want also to thank our co-host, the WHO Europe and the WPA for bridging forward this webinar. It's a great honor and privilege to be with you today and moderate this event. I now have the honor to invite Dr. Hans Kluge, Regional Director for Europe of the World Health Organization, to open our webinar. Dr. Hans Kluge has begun his term as WHO Regional Director for Europe on February 1st, 2020. He has 25 years of experience in medical practice and public health in numerous settings across the world, including Siberia in Russia, Myanmar, and North Korea. Dr. Kluge joined WHO in 1999. Before being elected as a regional director, he has served for 10 years as the Director of Health Systems and Policies of the WHO European region. And in 2018, he was the mastermind behind one of the most historic documents ever adopted in global health history, the Declaration of Astana on Primary Health Care. Honorable Regional Director Dr. Kluge, the floor is yours.
Thank you so much, and good morning, good afternoon, good evening, Professor Fountoulakis, Excellency, Madam Vice Minister of Health Rapti from Greece, Professor Javid, President of the World Psychiatric Association. I am truly glad to be with you today and to open this fantastic webinar for a number of reasons. As often as I can, I try to meet with those on the front line, doctors, mental health nurses, health managers, psychiatrists, psychologists, to understand to the extent possible what they are experiencing and how I and my team may help. That is what WHO is about, serving the people and the healthcare workers who have dedicated their lives to saving lives and leaving no one behind. I am very well aware that the city of Thessaloniki, its people and health workers have paid a heavy price in this pandemic, making the topic of today even more urgent. So thank you so much to Professor Fountoulakis, Professor Javid, and to WPA for this opportunity to join you virtually in Thessaloniki, the motherland of Aristotle, whose ideas led the foundation of evidence-based medicine. I am also pleased to be joined by Her Excellency, the Deputy Minister of Health responsible for mental health in Greece, Madam Rapti, a very respected colleague and old friend. WHO has enjoyed long-lasting collaboration with Greece in the area of primary healthcare. As we are looking to develop a sub-regional office now on quality of care and patient safety in Athens, I am very confident that the ongoing psychiatric reform in Greece that takes into account the effects of the pandemic on mental health will be another important area of collaboration between WHO Europe and the Greek government. My heartfelt thanks to you, the mental health professionals on the front line, my heroes. I know that the conditions under which you are working are extremely challenging, but your commitment is making a difference to the lives of countless people. Some 100 million COVID-19 cases have been reported to WHO at the global level. The European region remains at the high plateau of new cases and deaths, seeing 1.4 million new cases last week. And bear in mind that behind every figure, every individual, there are dozens of friends, loved ones, and relatives who suffer. While no one knows with certainty how the coming weeks and months will develop, and while it is still early to speak about life post-COVID, it is absolutely the right time to reflect on what we can do to make our health systems more efficient and resilient. In terms of public mental health, during the first months of the pandemic, the main psychological impact was elevated rates of stress or anxiety. But as new measures and impacts came about, especially quarantine and lockdowns, and the knock-on effects on many people's routines and livelihoods, levels of depression, alcohol and drug use, and self-harm or suicidal behavior rose. The impacts on mental health can be split into three: the direct effects of disease outbreaks, such as anxiety, indirect effects of public health and social measures, such as isolation, and indirect effects from the socio-economic fallout that lead many into debt and exclusion. The consequences on mental health affect all age ranges, children and adolescents, as disruptions to schooling, adults, through in unemployment and poverty, and the elderly, in the form of social isolation. Young people's risk of becoming ill with COVID-19 is small, but the long-term mental health impact of social and public health measures could be far more damaging. I see it with my two own daughters. We have all been impacted, but not everyone has been impacted equally. The mental cost of the pandemic is much higher for the poor and vulnerable, heightening pre-existing inequities in Europe as well as globally. During the acute phases of the pandemic, with lockdowns in place across the region, resources have often been reallocated. Consequently, access to mental health services has been dramatically reduced, while demand has increased. With services so heavily disrupted, it is now our duty to determine how to step up provision and address increased psychosocial needs. On a more positive note, COVID-19 has revealed that when necessary, we can make enormous policy and societal shifts. Health, including mental health, can and must become central to recovery. Before the pandemic, I had already identified mental health as priority in Europe. Working as a doctor in complex contexts myself, I have seen firsthand the impact of inadequate services and stigma on mental health. To me, that personal and professional experience has been a catalyst for my work at WHO. Most, if not all, European countries express a growing concern about the public health challenge of poor mental health, the impact of stigma, and increasing inequalities. Even this morning, I had a video conference with the Minister of Health of Andorra. Well, the minister was telling the same problematic. And to reflect that, mental health is a key priority in WHO Europe's Vision for Health, the European Programme of Work 2020-25, United Action for Better Health. This strategic work plan was developed with the input from non-state actors and unanimously endorsed by member states at our annual governance meeting last September. This area of work is managed through a mental health coalition under the auspices of Her Majesty Queen Mathilde of Belgium, the Sustainable Development Goal advocate. The coalition brings together member states, innovators and advocates, but most importantly, service users and you, the mental health providers. There are three goals: address stigma and discrimination, bring mental health care to the community, and third, reform policy and investment structures. In closing, I would like to draw your attention to the considerable scope we have to better meet the many health needs of our communities, mental health among them, as we come to terms with how COVID-19 has affected our lives. The joint trauma of the pandemic provides us with a rare opportunity to reshape the way we care for each other and create a shared environment of health and well-being. In adversity lies opportunity. I hope your exchanges today will be fruitful and reverberate in your work for months to come. Thanks for your work and for the opportunity to be with you today. Stay positive, stay healthy, stay safe. Thank you.
Thank you very much, Regional Director, for your inspiring intervention. I would now like to give the floor to our co-moderator for today, Dr. Dan Hisholm, from the Mental Health Unit of the WHO Regional Office for Europe, to introduce himself and the next speaker. Dan?
Great, thank you so much, Kostas, and thank you also to you and the team for all the hard work that you have put into organising this webinar. We greatly look forward to working with you in your capacity as the newly appointed WHO focal point for mental health in Greece. So as just stated by the regional director, mental health is one of 4 flagship initiatives in the European programme of work over the coming years. And this really does present an exceptional opportunity for us all as a community to transform attitudes about mental health, expedite mental health service reforms, and also accelerate progress towards universal health coverage for persons with mental health conditions. And I think this webinar is an example of the kind of collaboration and partnership that is very much needed in order to progress towards those goals. Let me now move to our next speaker. I'd like to invite Her Excellency Vice Minister Rapti for her opening statement. Ms. Rapti is a graduate of the Law School of the University of Athens and also holds a Master of Law from the University of Kent in Canterbury in the United Kingdom. In the past, Vice Minister Rapti has served at the Board of Directors of the Greek National Procurement Organisation, as well as Chair of the National Committee for Medical Tourism of the Ministry of Health in the framework of the Health Reform Support Programme of the Greek government, which has been carried out in collaboration with WHO Europe and the European Union. Vice Minister, the floor is yours. Welcome.
Thank you very much, Dr. Chisholm. Good morning, good afternoon, and good evening. Honorable Regional Director for Europe, Dr. Hans Kluge, esteemed Professor Afzal Javed and Kostas Fountoulakis, dear mental health professionals and academics from so many countries around the globe, I feel privileged today having the opportunity to address such a large international audience during these unprecedented times that millions of our fellow human beings are fighting with this insidious and invisible enemy for the last year. I would like to start by thanking WHO and the World Psychiatric Association for convening the meeting, and the Aristotle University of Thessaloniki, and you personally, Professor Fountoulakis, for hosting it. This is perhaps one of the most crucial times in our recent history for such a webinar on mental health, as we struggle with the profound impact of the COVID-19 pandemic. I'm also pleased to be here today with the Regional Director for Europe, Dr. Hans Kluge, who, apart from being the top advocate for health for all in Europe and beyond, he is passionate about improving health systems in order to be people-centered, integrated, and of high quality, leaving no one behind. A true Philhellene, Dr. Kluge is supporting Greece the last decade to strengthen its primarily healthcare system, and I hope that I will have the honor to work closely with him the years to come to strengthen our mental health services and conclude the psychiatric reform in the country for the benefit of the Greek people. COVID-19 has taught us some harsh lessons. It has highlighted the fault lines in our societies and our health systems, laid bare our tendency to underfinance and underprioritize health, and especially mental health. Unfortunately, the motto "no health without mental health" has remained rhetoric for many decades, and the current pandemic has revealed how fragile humanity is. But what are the effects of COVID-19 to mental health in Greece? Today, a total of 150,000 COVID-19 cases and more than 5,000 deaths have been reported in Greece. From anxieties around virus transmission, the psychological impact of quarantine and self-isolation, to the effects of unemployment, financial worries, and social exclusion, the mental health impact will be long-term and far-reaching. And it is very clear that although impacted differently, no demographic or age group has been spared. Elderly populations faced increased exposure to isolation, loneliness, and social exclusion in order to protect themselves physically. Other adults had to navigate daily uncertainty around employment, income, and how to meet the needs of their families. Health workers carried an enormous mental health toll in their workplace and often without adequate support. Although children and adolescents can contract and transmit COVID-19, they have largely been spared from the direct health effects of the virus, with most cases of COVID-19 in these age groups being mild or asymptomatic. Despite this, they continue to be negatively impacted by lockdown measures that may inadvertently do more harm than good, such as school closures. Overall, the harmful effects of the pandemic have not been distributed equally. The poor and vulnerable have been hit most severely and often with the least access to the essential services so fundamentally they deserve. Moreover, COVID-19 itself can lead to neurological and mental complications such as delirium, agitation, and stroke. But the pandemic has also severe effects on mental health services around the world, just when they are needed most, while the demand for mental health is increasing. The need for increased funding for mental health is now more urgent than ever before. As the pandemic continues, even greater demand will be placed on national and international mental health systems and programs that have suffered from years of chronic underfunding, especially in Greece, due to the financial crisis. Although around 2/3 of the countries globally have adopted telemedicine to overcome disruptions to in-person services, there are significant disparities in the uptake of these interventions, at least in Greece. The main question to be addressed by policymakers at this moment is how we can recover both in the short and medium term, but also to be able to manage the long-term effects of the COVID-19 pandemic. First, we must allocate resources to mental health as an integral component of recovery plans, so that more people can have access to affordable mental health care. Furthermore, we must scale up quality services in both community-based primary care settings and specialized secondary and tertiary care settings. Immediate priority is the implementation of psychosocial and mental health support programs in order to address the psychological consequences of the pandemic, especially to children and adolescents, the elderly, and other vulnerable populations such as homeless, drug addicts, and prisoners. The support of the frontline healthcare professionals consists also an equally important priority. I'm very pleased to hear that mental health is so high in the agenda of the regional director, Dr. Kluge, and forms one of the 4 flagship programs for Europe. In Greece, our Prime Minister, Kyriakos Mitsotakis, having understood in time the tremendous effects of the pandemic on the mental health of Greek citizens, created a mental health portfolio at the Ministry of Health and appointed a deputy minister in the midst of the pandemic, while the Greek Parliament approved the increase of mental health budget by 62% 2 months ago. We are currently implementing the following 5 programs: psychosocial support to COVID-19 patients and their relatives, psychosocial support to chronic patients, including cancer patients, psychosocial support to children and adolescents, including educational programs for their carers and healthcare professionals, establishment of special units for autism and provision of psychosocial support to families, and establishment of special units for dementia. We have also legislated the early intervention for psychosis, as well as programs for the psychosocial support of university students. At the same time, we're determined, together with the Minister of Health, Dr. Vasilis Kikilias, and the support of WHO and WPA, to move forward and conclude the psychiatric reform in Greece, focusing on the de-institutionalization of the last chronic patients still hospitalized in the 3 remaining psychiatric hospitals, and the integration of mental health services with primary care. We are now designing the next steps of the reform towards a forward-looking mental health system, taking advantage of the financial support of the European Commission through the new EU for Health program. This will significantly increase our investment in health and contribute to the development of a stronger and more resilient and accessible mental health system. Finally, nothing can be achieved without strong partnerships, effective collaboration, and solidarity at all levels: global, national, and interpersonal. From the COVAX facility to guarantee universal access to vaccines, to a phone call to a colleague to see how he or she is managing with the pandemic, all these are actions to be further reinforced to ensure that everyone overcomes the challenging weeks and months ahead. No one is safe until we are all safe. Thank you very much and wish you a fruitful webinar today.
Thank you so much, Vice Minister Rapti. That was excellent account of the many of the issues that are facing all of the countries in the region and beyond. And you touched on the multiple effects on different groups and the multiple requirements that are needed to scale up the response. And it was very heartening to hear about a 62% increase in the budget. So we need to, hold that up as a good example for others to follow. So thank you very much again indeed. And we will now pass to our next speaker, which is Professor Afzal Javed. Professor Javed is a consultant psychiatrist in the UK, also teaching at Warwick Medical School, and he's the chair of the Pakistan Psychiatric Research Centre. And as we know, he's now serving as the president of the World Psychiatric Association. So, Professor Javed, the floor is yours.
Very much, Dan. Good morning, good afternoon, and good evening to all the participants. Honorable Minister, respected Regional Director Europe, dear friends from WHO and Professor Fontolakis. This is indeed a pleasure and privilege to be a part of this very important webinar. We are grateful to the University of Thessaloniki, but more importantly, the involvement of Greek government represented by Honorable Vice Minister, and important role played by World Health Organization, especially its regional office in Europe. After listening to the regional director and the Honorable Minister, I thought that I don't have anything to add because they have actually advocated the mental health, the importance of mental well-being in such an extremely effective way that I will consider that they are actually advocating the cause of World Psychiatric Association. Thank you very much, Minister, and thank you very much, Regional Director, for keeping mental health in your agenda. I'm personally aware of the developments in Greece, especially about the legislation for early intervention, which is certainly a role model for many of our countries. And similarly, the emphasis placed on mental well-being by the European Regional Director again puts emphasis that no health without mental health. But more importantly, mental health is not the agenda of only of mental health professionals. Mental health agenda is the agenda of everyone. I also feel very honored that this is a very innovative type of webinar where we have got blessings from WHO. We are presenting the support from World Psychiatric Association, that is the representative organization of more than 250,000 psychiatrists, having around 145 member societies in different countries. This is a joint effort. This is something which needs dedicated leadership, as we are seeing today in the webinar. And this also needs a vision that WHO is driving in terms of a better health for everyone. I think Dr. Kluge has rightly mentioned about the impacts of COVID, whether this is short term, intermediate term, or long term. Mental well-being is going to play an important role in getting and sustaining the social architect and the network of our society. When we say that around 25 to 30% of general population have got some type of mental health problems or difficulties, the important slogan, 1 in 4 or 1 in 5, signifies that while we are talking about any planning, we have to keep these people in our mind. And when it comes to a disaster like COVID, it's a pity that sometimes mentally ill or people with chronic mental illnesses are forgotten. WPA is recently launched a campaign to approach respectable health ministries all over the globe that when and if the vaccination becomes available, especially in low and middle income countries, there should be a priority for chronic mentally ill. We are not overemphasizing the importance of mental health. We are only trying to sensitize the planners, the policymakers, and those people who are going to run and advise us about the future health policies. It has been mentioned about the impact of isolation, quarantine. I think this disaster, I hope that we don't get it anymore during the century, but at this moment, we do not know what will be the long-term consequences. literature is now showing the long COVID. And if you look at the long COVID, fatigue, tiredness, apprehensions, anxiety, depression are coming up as salient features that people continue having even though they may have recovered from the acute phase of COVID. The other important thing, we are still struggling to find evidence. What to do, how to do, and where to do. I feel WHO should be congratulated, and especially the government of Greece, for supporting this webinar. This is probably one of the innovative ways of getting evidence and gathering information that what are the lessons that we have learned. It will take ages before the scientific evidence comes, but probably our experiences from different countries, our narrative views about what should be done or what they have done will actually give us a sense of direction. So I once again thank the organizers, and I can assure you, especially to the government of Greece, through the Honorable Minister, and more importantly, through our regional director, Europe, that World Psychiatric Association will be assisting you, will be at your disposal, and will provide all possible assistance while you are having different plans to face this disaster. I do hope that through the courtesy of our European Regional Director and the European Regional Office, we may be able to reach to the other regions and suggest that a similar type of activity will be very helpful in the rest of the regions of the world. There is no big or small country. There is no high or low income country that is spared in this disaster. Even the high income countries can learn a lot from low income countries where there are limited resources. So ladies and gentlemen, this is a beginning. And this is something which we will follow. And I, on behalf of World Psychiatric Association, once again thank the organizers, especially Professor Fontoullakis, who is also a board member for the Southern Europe of WPA. And we hope that we will continue having further collaborations with WHO in coming years. Thank you very much. And I look forward listening to the recommendations and the conclusion or the summary of the seminar, which we will disseminate and circulate to all our member societies for guidance, for vision, and for implementation. Thank you very much and all the best.
That's great. So thank you very much indeed, Professor Javid, for such enthusiastic intervention, but also a very thoughtful and at times sobering reflection when, for example, you refer to the long-term mental and neurological manifestations of COVID itself, as well as the huge social implications of the crisis on people's mental health and well-being. WHO, whether at regional headquarters or country office level, very much looks forward to continuing and strengthening its collaboration with WPA. as we all move through and beyond the current pandemic. Okay, so this brings to a close the opening statements, and we'd like now to proceed with the second part of the webinar, where we would hope to hear from a number of colleagues in countries from across the European region, their insights and views about the situation in their local context. And we're going to start with Greece and Professor Giannis Giannis. He's Professor of Psychiatry and Addiction Psychiatry, as well as the Director of the Neuroscience Sector of the School of Medicine at Aristotle University in Thessaloniki. He's has a fellowship in Addiction Psychiatry and Substance Abuse Treatment from Yale University, and he's the head of the Drug Dependence Unit at the Department of Psychiatry and the chairman of the psychiatry at the Papa Georgiou General Hospital. He's also served as the national representative of Greece to the Scientific Committee of European Centre for Drugs and Drug Addiction in Lisbon. So, Professor Giannis, welcome, and the floor is yours.
Thank you very much. Madam Deputy Minister of Health, Mr. Director of WHO Europe, Mr. President of WPA, distinguished guests, dear colleagues, thank you for the opportunity to present the impact of COVID-19 pandemic on psychiatric care in Thessaloniki. In early March 2020, health services were required to balance infection control with access to care for patients, and mental health professionals were advised to minimize the number of face-to-face patient contacts, and restrictions on non-urgent care were applied. As the epidemic is still ongoing, there are several precautions to ensure the non-transmission of the virus. Outpatient visits are limited to 50%, and patients who visit the outpatient clinic for the first time are limited. Follow-ups after admissions are nearly fully suspended. On top of that, patients with appointments are obliged to wait outdoors until the consultant calls for them. As expected, the entrance is restricted in case of high temperature or relevant respiratory symptoms, and single-use medical face masks and antiseptic are compulsory. All patients are asked to fill out a COVID-19 related information sheet to calculate the risk of being infected. The number of psychiatric patients visiting the emergency department was significantly lower during 2020 compared to 2019, possibly due to a fear of contracting the virus. In the emergency department, psychiatric physicians are providing care in person with protective equipment. Patients considered for psychiatric admissions are undergoing PCR to determine COVID-19 status, and many times they have to wait for many hours for the result. And when the test turns out to be positive, the patients are admitted to COVID-19 unit. Difficulty to employ safety precautions and isolating patients with symptoms led to the tightening of admission criteria, especially for voluntary admissions. Many psychiatric wards have been closed and transformed to COVID-19 units. Actually, in Thessaloniki, all the other psychiatric clinics in general hospitals are converted to COVID-19 units, except our clinic in Papa Georgiou Hospital. And the admission for drug and regimen modification or management of side effects are postponed. The new license to private psychiatric clinics to accept involuntary admissions will ease the burden imposed on public hospitals. As a result of all these measures, the mean duration of hospitalization was shorter and the bed occupancy dropped by almost 10%. A no visitor and no passes policy were applied, and all group activities were suspended, with the exception of eating in the dining area in different time frames. For vulnerable groups, meals were delivered to patients' rooms. Patients have to stay in psychiatric unit throughout the hospital stay, with no permission to visit the cafeteria or the hospital restaurant. Regarding patients' discharge status, in some cases, stable psychiatric patients are experiencing longer psychiatric inpatient lengths due to the lack of underfunction of care facilities. And at the other hand, Not fully recovered patients are prematurely discharged to continue treatment at home due to lack of available psychiatric bed, or just in order to keep distancing. To address the increased need, apart from in-person sessions, teleconsulting services through phones were provided for outpatients and e-prescriptions were favored. All inpatients are receiving mini COVID-19 educational session as they are potentially super spreaders, struggling to stick to the necessary medical precautions. Communication with relatives and friends facilitated throughout hospitalization. A phone line decline to relatives seeking information, especially for COVID-19 patients, is established on top of in-person sessions for those seeking support. Several helplines are functioning across the country to help the general population cope with the situation, and awareness videos addressing mental health issues were uploading to official sites. Our clinic also provides a special support service for healthcare professionals to actively respond to their concerns, which can include work overload, working without proper training, witnessing human suffering, making life and death decisions, fear of infecting family members, fear of getting sick, and mental exhaustion. The fear of transmitting the virus to relatives has been the most intense fear of healthcare professionals are facing, based on the research conducted by our scientific team. Recent research predicts that it may be an increase in mood disorders, anxiety, insomnia, PTSD, and OCD symptomatology. Our plan is to address these issues by potentiating telepsychiatry services and ensure the vulnerable populations receive the appropriate care. In that context, we plan to provide a grief support service for those whose loved ones died from COVID-19 and a resilience training program for healthcare professionals. Although most individuals who develop distress after a crisis demonstrate resilience and recover naturally, we need to work on prevention of mental health deterioration. Therefore, we are in the progress of designing brief interventions focusing on coping skills, problem-solving, relaxation training, and positive activity scheduling, aiming at relapse prevention. Thank you very much.
Thank you very much, Professor Diakogiannis, for your excellent presentation.
So I think actually the next speaker then would be Dr. Maria João Reto dos Santos from Portugal. We were also expecting an intervention from Professor Pompi to give the perspective from Italy. However, Professor Pompi is unwell and unable to join. So we wish him a speedy recovery, and we'll go to the next country perspective from Portugal. So let me introduce Dr. Santos. He's the Director of Psychiatry and Mental Health of the Department of Psychiatric Services at Beatriz Angelo Hospital in Portugal. She also serves as a researcher at the Institute of the Environmental Health, the Faculty of Medicine, University of Lisbon, and a member of the National Council of Mental Health. She's also a member of the board of the College of Psychiatrists of the College of Physicians. Dr. Santos is also president of the Portuguese Society of Psychiatry and Mental Health and a WPA representative for SPPSM. So, Dr. Santos, if you are ready and willing, please go ahead, and we look forward to hearing from you. You have the floor.
So, thank you very much for the introduction. Good morning, good afternoon, and good evening. I would like to greet Vice Minister of Health of Greece, WHO Regional Director for Europe, WPA President, the moderators and the discussants of this session, as well as my colleagues from Greece, Russia, and also Italy. And I would like to thank the organizers in the person of Professor Kostas Fontolakis, who invited me. It is a pleasure and honor to be here on behalf of the Portuguese Society of Psychiatry and Mental Health. Currently in Portugal, we have one of the worst reported daily cases and deaths per million among European and world countries. Health services are overburdened, many of them already in collapse. On top of that, we are living a very serious social and economic crisis. All this has consequences on mental health and well-being. We have run a study with more than 6,000 people between May and July 2020. We found that more than 1/4 of the general population and around half of health professionals reported symptoms of distress, referring complaints of moderate to serious anxiety and depression, as well as post-traumatic stress disorder. In the general population, women, young adults, unemployed, and the most deprived low-income population reported more symptoms. In what concerns the direct and indirect effects of the virus SARS-CoV-2 on mental health services, 4 aspects. 1, there is a need to reinforce the support of the most vulnerable populations and in particular fields such as psychotic patients, alcohol and other substances abuse and dependency, domestic violence, jobless patients, older patients, namely with dementia. 2, we now lack the support from primary health care for common mental disorders, as family doctors and nurses are busy with those patients with COVID-19 who are staying at home. 3, junior doctors, mainly besides the clinical psychiatric activity, are also at general emergency rooms to fulfill the scarce resources. 4, there is a heterogeneity of human resources among local mental health services, and the usual lack of community facilities reflects even more nowadays. We had to reorganize our mental health services and psychiatric practice according to a national mental health rule from the Ministry of Health and to the local hospital contingency plans. 1, each psychiatric department offered support to health professionals, patients and families through telepsychiatry, support lines, crisis intervention, and first aid mental health. 2, well-being promotion measures for health professionals at hospitals were implemented. 3, day hospitals were adapted to activities in smaller groups or sometimes even telepsychiatry. 4, outpatients clinics were only partially replaced by telepsychiatry. 5, whenever needed, we have reinforced the consultation liaison, psychiatry and psychology teams in general hospitals to support the neuropsychiatric complications of COVID-19, also to follow the psychiatric COVID positive patients admitted outside the psychiatric wards and to support their families. In this third wave of the pandemic, we have to include in the psychiatric wards a few medical patients to alleviate the general medical wards. How in Portugal we plan to tackle mental health needs with an anticipated rising longer-term impact of COVID conditions? 3 words: communication, coordination, and intersectoral collaboration, targeting the most vulnerable and at-risk populations. Finally, we have learned some successful mitigation strategies and promotion measures towards a positive mental health and stigma reduction to increase quality of life and an adequate functionality of human populations despite the enormous limitations in social interaction we are living. Thank you.
Thank you very much, Maria, for your excellent presentation. I would like now to invite again Professor Smirnova from Samara University to present the Russian Federation perspective. Professor Zlutnova is the Deputy Director of Clinical Issues of the Neuroscience Research Institute and Head of the International Research Lab in Neuropsychiatry. Dear Daria, the floor is yours.
So it's my great honor to contribute to this very important event. Thank you very much to Professor Konstantinos Fontolakis, thank you very much to WHO and WPA team for inviting and for this opportunity to share our key points and I would say keynotes from Russia. And I'm going to focus on the experience of the past we meet regarding COVID-19 pandemic and the future interventions towards our better patients management. So as the whole world, Russia fights coronavirus, and this is the stats we need to know today. Russia confirmed more than 19,000 new coronavirus cases yesterday and 575 deaths as Rosstat reports. And the deaths already surpassed 70,000, while massive vaccination has been started. You can see that we have a web platform, Yandex, where all the new cases, all the recovery cases and deaths and confirmed cases are placed, and everybody can see it. It's open data. And you can see that two capitals, Moscow and St. Petersburg, and Moscow region are mostly affected by COVID-19 pandemic. And we also check the information at the Russian version of WHO website, and we can see that there is crude cumulative death indicators counts 491.2 per million population. Russian mortality hit 16-year high in November, and it was the deadliest month for Russia, as official data says. And we can also see these monthly fatalities across Russia, and this 2,500 excess deaths on one day in November. So the new figures reveal that more people in Russia died in November 2020 than in any single month for at least 16 years in Russia. And the earliest data were available. However, the Deputy Prime Minister Tatyana Golikova commented that more than 81% of the excess deaths were related to coronavirus. And you can see all the information open at the official state starts web resources and commented by the government. So it depends on how we estimate the death rate. So we can see the daily updates, and we can see this graph with the columns on COVID-19 as a main cause of deaths, and COVID-19 which was present is a person who passed away. For example, in one of the regions, we can see the mortality rate, which is different as compared to 2019 by 11,000 deaths, but COVID-associated stats is 760 cases. Anyhow, government comments on how we estimate the death rate. We can see also the paper which is published by the economists about excess death rates and weekly death rate, which continue growing in Russia. We have state orders, the list of state orders available at the web resources of health for healthcare system at the Ministry of Health of Russian Federation website, as well as always updated clinical guidelines or recommendations regarding the treatments of COVID-19. in a very modern format, and IT technology is used when you can use QR code and download all the recent recommendations. So we can also see the difference at around 500,000 of people as compared to 2020. Reduced in Russia, but this is due to many factors. It's also due to coronavirus pandemic, but it's also because of restricted migration and falling birth rates. So not only coronavirus contributes to the population statistics. And I would like to say that we have different kind of recommendations placed at official web resources, including guidelines and recommendations for medical staff to improve their psychological well-being, and guidelines for medical staff on how to cope with the stress at their working place. We also have the website open of the memory list of medical staff, medical professionals who passed away due to COVID-19. And unfortunately, the list of obituaries at the Russian Society of Psychiatrists website, including very recent cases in January 2021. During pandemic, Russia experienced COVID-19 outbreak in psychiatric hospitals and long-term facilities and nursing homes. And mostly during the first lockdown, first quarantine during spring 2020, for example, we can see that there was 70 cases in a psychiatric hospital in Arkhangelsk, and it was closed for quarantine together with all patients and all medical staff for 2 weeks. And also we had outbreaks in long-term facilities, in 16 long-term facilities in 7 Russian regions with 457 people being infected with COVID-19. And there was also a volunteers movement in Russia when people from families took elderly people with mental health illnesses to their homes to take care of them. But in the second wave, in another lockdown, we didn't have such horrible statistics. So we learned already from the first lockdown. And you know that Russia is now involved in massive vaccination, and we have Sputnik V vaccine and also 2 more others vaccine, Epivac Corona, which is now registered. And we have the efficacy of Sputnik V is over 90%, but we know the limitation of the study of the first and second stage of the clinical studies. I would like also to pay your attention about key point statistics of mental health services in Moscow. Thanks to Professor George Kostuk, the Chief Psychiatrist of the Ministry of Health of Moscow, who has shared this information. So mental health services in Moscow include 6,815 beds, where more than 2,000 psychiatrists are working. And what we can say about the statistics that, for example, in 3 Moscow clinics, they had around 30% of beds closed for COVID during 2020. However, this indicator had been fluctuating. So in total, 851 beds have been transformed into COVID beds in Moscow. This is the scheme of the hospital management facing COVID-19 at the Moscow Mental Health Clinic number 1, which is the most famous and the oldest in Russia. And you can see that the unit for COVID-19 positive patients have been organized, where staff have been monitoring drug interactions when treating COVID, and discharge or transfer to the unit for COVID-19 negative mental health patients was able only after ELISA negative test on antibodies.
You need to conclude in 2 minutes.
Thank you very much, dear Prof. Kostas. And also they invented filter zone or probationary unit where patients stayed for 2-3 days, and those patients who were suspected for COVID-19 symptoms. Each hospital in Russia also has intensive care unit, also arranged for the needs of COVID-19 positive patients. However, patients, when they develop pneumonia, they are transferred to general hospital, to general COVID-19 hospitals. This is a daily summary list of mental health patients in Alexeyev's Moscow clinic, when they measure all the symptoms of COVID, and all online meetings for the staff have been available, and even meetings of patients with their relatives have been provided for patients in this clinic. Also, some comparisons with the local statistics in the region. We have here the hospital, which counts 1,370 beds, 20 units, and the indicators of COVID transformed departments is around 5 to 10%. We can also see that hospitalizations to psychiatric services have been decreased during 2020 as compared to 2019 by 21% in total. However, geriatric patients hospitalization, the proportion of them have been increased. Also, we have data from private outpatient clinic in St. Petersburg, which showed that there was a significant growth of affective and mood disorders and anxiety stress-related disorder during quarantine in 2020. And as for distribution by ICD-10 diagnostic groups, we can see that there have been prevailed visits of patients with OCD, obsessive compulsive disorder, mixed anxiety, depressive disorder, and adjustment disorder, stress-related disorders. Also, there was a Depression Day, which we organized as a webinar in Russia, and Professor George Kostyuk said, "We have not registered the growth of affective disorders rate in our state mental health service during the first COVID-19 quarantine in Moscow, but it was difficult to purchase CCRIs in the capital, in the pharmacies, according to our patients' reports." And the private clinic in St. Petersburg reported the excessive prescription of benzodiazepines, significant increase in St. Petersburg. Also, many mental health patients were impressively large amount, more than 90%. They were conservative and sometimes completely ignoring both the pandemic and the associated stressful factors. Females were about 2 times more fragile, vulnerable to COVID-19 stress. And the frequent use of benzodiazepines in 2020, we interpret are more likely associated with the increase of severity of anxiety disorders. I would also like to mention the study, which is guided by Professor Konstantinos Fontolakis as a principal investigator. It includes 40 plus countries representative, and we received approximately 60,000 responses and have 27 language versions of questionnaire. And what we found in Russia, out from almost 10,000 responses, that there is a significant stress and reduced quality of life and increase of mood and anxiety disorders.
We're out of time.
So I would also like to say that there was internet survey about effect on mental health of medical professionals related to anxiety and depression. And I would like to point your attention also to targets to act on. Quote Professor Nikolai Neznanov, who is Russian Society of Psychiatrists president. What we should do, and my presentation will be available. Thank you very much, and stay safe and keep calm, and really do breathe in during this time.
Thank you, Daria, for your great input. Now we will move on to the discussion section, and I will kindly ask our discussant in 3 minutes each to elaborate on what was presented so far. We will start with Dr. Jonathan Campion, Director for Public Mental Health and Consultant Psychiatrist at South London and Maudsley NHS Foundation Trust in the UK, followed by Ms. Claudia Martinelli, Director of Mental Health Europe, followed by Dr. Pavlos Theodorakis, Senior Health Policy Advisor at the WHO Country Office of the Regional Office for Europe in the Russian Federation, and eventually followed by Professor Peter Morozov, WPA Vice President in Russia. Dr. Campion, please. The floor is yours.
Thank you very much, and honoured to be able to speak, and much appreciated for the invitation, Professor Costa. So thank you, and all honourable speakers and guests. Just really wanted to highlight, yes, on in addition to the wonderful presentations that have happened already, that across the WHO European region, mental disorder is responsible for about 22% of global of disease burden, which is an underestimate of about a third. And in 2015, WHO estimated 25% of the population across the region was affected by a mental disorder. And if we apply that to 900 million, almost 900 million population, that would give about an estimated 225 million people affected by mental disorder across the European region prior to COVID. And the cost of that, estimated by OECD, is 600 billion euros. That was just across 28 EU countries in 2018. As we've heard, we've got evidence from international reviews, but also the amazing research that has gone on across the European region about the impacts of COVID on mental health through impacts on a range of risk factors, impacts on social isolation, quarantine, and also the risk of developing mental disorder as a result of getting COVID, and that the risk is disproportionately occurs for particular groups. WHO did a fantastic survey of 130 member states and found that there'd also been a severe impact on services, and that was particularly evident across the European region. The good news is there are fantastic evidence-based interventions that exist to both treat mental disorder, prevent associated impacts, prevent mental disorder from arising, and also promote well-being and resilience. The problem, though, is even prior to COVID, the coverage was very poor, particularly in middle and lower income countries. And of course, with COVID, that implementation gap has been exacerbated. And that will obviously be particularly poignant at this moment. So we've had a problem prior to COVID, which has been exacerbated. And so there's a huge opportunity, I think, particularly with the exciting integration, a central part of mental health in WHO's work, that we can really look, first of all, to assess the size, impact, and cost of the gap, taking into account COVID, and to also examine what are the main reasons for the size of this implementation failure, and then put into place measures to facilitate scale implementation at speed to both address the increased level of mental disorder as a result of COVID, but also to prevent the mental disorder that we know will otherwise arise unless urgent action is taken. And so I think there's a real opportunity to be sort of taking several steps to enable, first of all, the estimation of unmet need, but then with the willingness of the member states to facilitate the implementation to scale. And obviously we've got a lot of experience. People have been evidencing different things through fantastic publications. I'm currently working with Dan Chisholm at WHO, just reviewing the impacts of mental health on COVID, and I think this will give us an opportunity to really address something that's required action for a very long time, And not only will that improve quality of life, prevent suffering to a very large proportion of the European WHO region population, but also improve the opportunities that good mental health brings and result in a range of economic benefits, which can be estimated. And of course, there's a difficulty at the moment with the impacts of COVID in terms of economically. And so I think I would just bring it back to a final point, which is that public mental health interventions result in broad impacts and associated economic benefits. And these economic benefits can be estimated to really highlight that actually investment in public mental health is part of sustainable economic development and will result in a broad range of policy objectives, not just within mental health, but across a range of other areas. Thank you.
Ms. Marinetti?
Thank you very much, and thanks for having me here today. I'm Dr. Claudia Marinetti, and I'm Director of Mental Health Europe. We represent service providers in the field of mental health, but also users of these services, and any person, professional that really wants to work from a human rights perspective towards mental health, good mental health for all. I found very interesting everything that I've heard today. I think that, that there are quite clear numbers when we make this link between the COVID-19 crisis and mental health. Let's say that, I wouldn't call it a silver lining, but that the COVID-19 crisis has also brought meaning to these numbers. And this meaning has been closer to people's experience. So the importance of mental health has become clearer to decision makers and the public, the wider public, which is quite important then because it would enable action. I just wanted, in terms of a comment of what I've heard, I think that there are some actions that really need to be made, and that they need to be made really considering the long-term impact. So some things have been done to face the immediate risks and the immediate problems concerning mental health, but let's also look at long-term solutions, which I think that we are starting definitely to do. One thing is really to allocate, of course, adequate funding to mental health support and care. I've heard, and also which is very much linked to also change with our mental health systems. I've heard, for instance, from the representative from Portugal, talking about the issue that, there is much less access to the general practitioners and nurses in primary care. Let's also invest maybe then, which should be done more and more, on peer workers, because in some cases that could be like the first type of support that people could have. We need to invest on community-based services. I mean, there are major problems with institutions, clearly in terms of human rights, but also in terms of how efficient they can be, especially when faced with specific types of crisis. And we therefore, should really try to move away from an institution-based model of care. This also means very much working closely with the healthcare providers, and even while they're studying. So also let's get very much the engagement also of students and medical students. And we also heard from the representative from Russia that there is this tendency of over-medicalization. There has been a major increase, for instance, in the use of benzodiazepines, and this is indeed, we knew that this was a risk, and this is linked again to try to change our approach to mental health, and now we can provide support to mental health. We need to also allocate adequate funding to address the socioeconomic determinants of mental ill health. And this has been mentioned by Professor Javed in a comment in the fact that mental health is not just a matter of health, it's not just relevant to the health sector. And also Dr. Kempe said that, I mean, we need really to to approach this from a mental health and law policies point of view. And another very important thing for which I think that there is really, it's a good window of opportunity that we have now, is to raise the awareness on the importance of good mental health, because people's attention is there now, but also to combat stigma associated with mental health problems, which I'm very pleased that it's one of the WHO Europe's priorities. Let's not forget the vulnerable groups, it has been mentioned, children and youth, women that are victims or at risk of domestic violence, people living in poverty or facing unemployment, for instance, people with reduced legal capacity, migrants, etc. And my last two points that I wanted to make, again, when we think and because in this moment it is important to start rethinking our mental health systems. One is really to make sure that we reaffirm the commitment to the rights of persons with psychosocial disabilities. So when we think about the new systems and support for people that are facing mental health problems, let's talk about commitment to legal capacity, to supportive decision-making, free informed consent, ending coercive practices, and of course, going ahead with the institutionalization processes. And of course, when we are designing, adopting, or implementing, evaluating any action, it is crucial to take a real co-production approach, which includes the users or ex-users of the services. And basically, it's really important to have a dedicated budget that allows every stakeholder to be involved if we really want to have a meaningful and effective participation and the psychosocial approach to recovery and also to increase resilience.
Thank you, Dr. Marinetti. Pavlos, it's your turn.
Thank you. Thank you, Kostas, Dan, for moderating this session, and all the speakers for their very comprehensive interventions. I was thinking very much what I could present and what my remarks would be. And after discussing with Kostas, and of course thanks to Hans Dan that has shared with me the 148th session of the Executive Board that took place last week in Geneva. I thought that it would enrich the session to see, apart from the three country perspectives that were presented today, since Italy was not able to see, also other countries in our region, and how vocal they were, and what concerns or proposals they raised during this session last week, right after 1 year of the start of the pandemic. The first point that member states suggested to be emphasized on the way forward was the importance of integrating mental health as part of emergencies preparedness and response planning and implementation. Norway, France, and Denmark were amongst these countries that were very vocal on this issue, and more specifically on this point, countries stress that additional guidance to countries on long-term solutions and strategies is needed, and that there is a great need to monitor and report more comprehensively on the impact of COVID-19 on mental health conditions, with an emphasis on frontline workers and healthcare personnel. The second point raised by the member states was this of stigma and discrimination against persons with COVID, particularly frontline workers, with increasing stigmatization and human rights infringements, especially increased violence against health workers. A third issue is that there was a notable mention of the impact of COVID conditions on the mental health of vulnerable groups. Many of our speakers and today refer to it, mainly adolescents, women, because of domestic abuse and sexual assault, people suffering with substance abuse and others. And Belgium, Austria, France, and Spain were amongst the countries that were very vocal on this point. A fourth point is the importance of risk communication and allocating greater investments towards mental health literacy in light of the widespread increases in people suffering with mental conditions, but also comorbidities as a result of conditions created by COVID. Portugal, Maria, was one of the countries that raised this point. The fifth point was a number of key approaches that were highlighted by member states as being key to addressing the rising demand that all of you previously referred to. And community-based approaches, of course, to mental health. And in this regard, what was stressed was that the mental health care needs need to be affordable and accessible. Again, Portugal, of course, digital solutions and telehealth for the provision of mental health services. Belgium was very vocal on this issue and the importance of trainings for frontline and health professional workers. Last but not least, the sixth issue raised was the importance of inter and multi-sectoral, multidisciplinary approach, which was also raised by Belgium. Hope that this addition in the country perspectives will be helpful. Thank you, Kostas. The floor back to you.
Thank you, Pavlos. And last but not least, Professor Peter Morozov. He is Secretary General of the World Psychiatric Association, professor at Moscow University, and he is the last commentator. Peter.
So, well, because I'm the last, I can say something. In the end, I have a very good impression generally about all this discussion. It was, without any doubts, very fruitful, very interesting, and useful for us. And I'm absolutely sure that we should think about the organization of similar webinars, not only in Europe, but in some other part of the world together, jointly, because their conditions are different in different regions. And Europe is quite rich region, and situation with COVID, it's favorable, first of all, because of the vaccination, large vaccination. The program in Europe is quite perspective and developed. And at the same time, I would like to use this opportunity to ask in the WHO to support our initiative when we address to all member state of our association, and to consequently to the whole government of the world, to make us priority in the vaccination process for the mentally ill as a most vulnerable, in my opinion, not only in my opinion and the experts' opinion, the most vulnerable part of the population. If you can look through the recent publication just yesterday in JAMA, it was that 3 times increased the risk of the suffering from COVID for the mentally ill comparatively to the general population. I think it is very important. Second point, another vulnerable group, of course, is it was mentioned a number of times here. This is children and adolescents. Why? Because they are less resistant. For instance, our population who overcome a number of crises, at least in Russia, I can say, in post-Soviet space, we are quite resistant. But young generation, we should pay special attention to them. I could also announce a very important initiative of Union for Mental Health. It's a non-governmental organization in Russia who make a fantastically designed study when they distributed a questionnaire among the more than 500,000 children going to the school with the help of the Ministry of Education. They use the internet facilities. So we are waiting for the results. It was number of questions regarding the post COVID reaction in the families and in the school, and we will see what will be the result, but I'm absolutely sure that we should make a very special attention to this group in the future, for the simple reason that about 40% of the mental illness started in the age before 25. It's quite known figures. This is a next point. Then this is an important point. The next point, which I would like to also mention, we should also think a little bit. It's from a research point of view, from the previous experience in Europe, not only in Europe, but in Europe in particular, because 100 years ago, we overcome the so-called Spanish flu, the influenza, and with also about 100 million of suffering people. And what is interesting, that after it was started actively described so-called infectional psychosis. And you can find it at, for instance, just give you some example, work of Professor Kleist in Germany, Professor Bangefer with their conception of endogenous psychosis. And I think it will be very important to think not only on anxiety, on depression, on post-traumatic stress disorders, but we will meet also some new type of psychosis. I'm absolutely sure we should think a little bit further. And one also point which really bothered me also, it's in the time of globalization and migration, we should think about transcultural aspects to reaction to this infection. I think that there are enough data who could also investigate the difference in reaction. So it is purely a research point. It's not, but I think it's very important. And I also make some comments to Daria report because she mentioned the recommendation which every month we receive officially from the Ministry of Health. But may I remind you, I would like to criticize a little bit the Ministry of Health. Among the 40 experts who put their recommendation to all of us, all Russian doctors, there are no one psychiatrist at all. And I think we should think about it and pay more attention to this part which we discussed today. That is my point, and I would like to thank in the end University of Thessaloniki and particularly Professor Fontolakis for his extremely important initiative. Thank you on behalf of all psychiatrists which we represent in WPA. Thank you.
Okay, so it's back to me, the tag team, back to Dan. And I'd just like to start by, of course, thanking each of those discussants for their insights and reflections. Jonathan came with a sort of public health, public mental health perspective. Claudia emphasizing the disability and psychosocial perspective and the need for user involvement, empowerment, and protection of human rights. Pavlos gave us a very helpful update from last week's executive board of the WHO, which is an important commitment from member states to ensure the inclusion of mental health and psychosocial support within this and other emergency responses. And just there, Professor Morozov talking about, among other things, the needs of specific priority vulnerable population groups. Now, we're very aware, well, one, that time is up, but also that we have not had time today for a good Q&A session with all the 200 plus participants that I see are still there on the in the registered and participating in this webinar. So we apologize for that, and we are planning and hoping to have further exchanges where we can plan to include more interaction with you and have some polls and more Q&A, maybe panels which can address particular topics. What we've heard today, though, I think is a mixture of very traumatic experiences faced by services throughout the region and populations throughout the region. But we've also heard about the enormous opportunities and also the sort of positive solutions that countries have found and have been forced to make, quite sometimes dramatic changes to the way that they deliver services. And that might provide, in fact, a really important roadmap or pathway to future provision of services. Just a couple of things to finish on. One of the kind of requirements in this, and emphasized by some of the member states, is the need to exchange knowledge like we are doing today, but also to sort of document what are these impacts. And the regional director who we heard from before, he is establishing a technical advisory group on the mental health impacts of COVID-19. Insights from this webinar can feed into the work of that group, but the job will be to do a scientific review of those impacts, and on the basis of that, determine some key priorities and needs for the future. Jonathan Campion also mentioned a survey of the WHO survey conducted last summer on the impacts of COVID on mental health policies and plans, also responses and service disruptions. That has been repeated across a large number of countries in the coming weeks. So this will provide new and updated information on across countries. With these brief thoughts, I would like to thank you all again very much for participating, and look forward to connecting again soon. And I'll give the last word back to you, Kostas.
Thank you, Dan. I think you concluded excellently this webinar. I hope we gave more or less a general picture of what the impact of this pandemic was on mental health, and especially on the mental health services, and what were the lessons learned and how we should go on and modify our responses and plan for the future. I hope we can, in the near future, we can organize again some kind of exchange of opinions and presentation of data and discussion. I think this will be the case then. A stronger collaboration between the WPA and the WHO, and a stronger collaboration with decision makers all around the world. Thank you all for participating. We are expecting you in the next webinar, until live seminars will be feasible. Thank you all.